closing costs. All it takes is a 5-minute phone call to see how we can save you thousands of dollars a year. So call Westland at 888-615-3669. Call us at 888-615-3669.
Phenix Financial Mortgage Corp. DBA Westland. NMLS 3304. Not all loans apply. Equal housing lender.
More than 11,000 Americans have died in nursing homes during the coronavirus outbreak, and that number will potentially increase as the federal government starts tracking those deaths in those facilities.
That was about a week ago.
Have offered immunity to nursing homes to protect them from coronavirus-related lawsuits, while 6 other states have issued protections for healthcare providers, which in turn could extend to
I didn't wear it yesterday.
Joining me now, the investigative reporter behind that report, Laura Strickler. So, Laura, what exactly did you find, and why would they be offering this sort of protection?
Well, what we found is that, as you said, 6 states have explicitly offered that immunity, and 6 other states have provided protection for healthcare providers. And this gives families who are concerned about accountability with nursing homes. It raises a lot of questions with them. And a lot of the nursing home advocates we spoke to said they're worried that there are fewer inspections right now going into nursing homes. Ombudsmen are no longer being able to go inside, and families don't have any visibility as to what's happening in there. So by removing the lawsuit option, they fear it creates a lack of accountability. The industry is pressing for this with states around the country. They're telling us they're worried about the lack of personal protective gear.
And this is Laura Strickler. Laura, thank you for that reporting. We appreciate it. And joining me now is Democrat of Pennsylvania Senator Bob Casey. Senator, I know that you're taking a concerted interest in what's happening in these nursing homes. Is it a good idea, as Laura Strickler is reporting, to shield nursing homes from coronavirus-related death lawsuits?
Hey, I don't think so. I don't think that's the answer in the middle of this crisis. We should be focused. Both the federal government and state government should be focused on the safety and quality care for residents. They should be focused as well on protection for the workers, because if you're doing a good job protecting the residents and the workers, you're going to be helping the community overall. But shielding facilities from lawsuits should not be the focus now. We have a lot more work to do, and I'm hoping that the federal government will respond more specifically to my request already to provide information so that when there is a COVID-19 case in a nursing home, that the residents know about it, the families know, and that the workers know. But the only thing that the administration is committed to is putting it on a rulemaking track, and that could take months.
Let me ask you about when an infection breaks out or when somebody tests positive for COVID-19 in a nursing home or an assisted living facility. Why are they kept there? Why are they not immediately removed and brought to a hospital and kept in a place where quarantining is more regulated? In nursing homes, there's staff that goes from room to room. A lot of them aren't as heavily trained as what you see in hospitals. You're among a vulnerable population. Why are there not more federal regulations, or why are governments getting involved in saying, listen, we've got to separate these people out from a larger population in a nursing home, because if it spreads, you could potentially see, as we've seen in other nursing homes already, death after death after death after death.
Well, there's no question that those who have a COVID-19 diagnosis should be segregated from others, and I know in some facilities they're trying to do that. They have a separate wing to keep folks who have a diagnosis separate from those who don't.
But is that enough? A separate wing, is that enough?
Well, I think for a lot of them at this point that may be the only option. But there's no question that there should be more support at the federal level for infection control and the kind of quality care that you need in a facility like that. I've been pressing for that, as well as the transparency of providing information to families, to the community when there's an outbreak. But we have a long way to go, and part of this is going to be what happens as you go from Medicaid funded. Most of the facilities are heavily dependent on Medicaid, and we're going to keep putting money at the federal level for more Medicaid dollars.
Let me ask you one other slightly off-topic question, but it is on-topic. Eventually, that is funding for states. A number of governors around the country have said that they need help, not just blue state governors, but red state governors as well. The president has claimed that it's Democratic state bailout that they're asking for. Where do you stand on that, and how much pressure can lawmakers put on Mr. McConnell with the president in order to make sure that firefighters, cops, farmers, teachers are paid?
That's exactly what we're talking about. We don't have an helper state and local government to talk about those people you just mentioned. First responders, public safety officers, police, fire, teachers, you go on the list. And unfortunately today on Twitter, President Trump is taking the position of Mitch McConnell, which is to have states declare bankruptcy. That is reckless and dangerous. If you want your local taxes to go skyrocketing, local or state taxes, then you would follow their advice. No state, no taxpayer should want their state to go bankrupt, nor the local government. So it's time for the administration and Republicans in the Senate to work with us, as they have not done so far, to work with us on greater support for these first responders and public safety officers. They don't seem to be interested in that so far.
Pennsylvania Senator Bob Casey. Senator, thank you very much for joining us. We wish you were under better circumstances.
Thanks, Katie.
And next, we're going to take you to Colorado, a meat processing facility that is home to one of the state's largest outbreaks of coronavirus. Several workers have already died, and now the plant is reopened for business today. What's it like there? Stay with us.
Thinking about getting healthier, sleeping better, or losing those last few pounds? Think Noom. Noom is a totally new approach that uses psychology and small goals to help you make lasting change. Backed by science, Noom shows you the why behind your decisions and habits and gives you the tools to change them for good. So get started today at Noom.com. Noom.com. Change your thinking, change your habits, change for good. With Noom.
These are tough times for everyone. So dealing with your timeshare may not be your biggest concern. But when this happens, do you still want a lifetime of payments, fees, and commitments for a timeshare you were misled into buying?
I'm Chuck McDowell, CEO and founder of Westway Financial. 2 years ago, I started a timeshare cancellation industry by exposing the ugly truth about timeshares and giving folks the straight facts. I've been fighting the timeshare giant for the years, so no one knows this industry better than me and my team. Today, we have over 200 employees, and they've saved our clients an average of $65,000 in lifetime payments. Imagine putting those timeshare dollars back in your pocket. Give my office a call today. I guarantee if we take these to client, we will cancel your timeshare contract, or you'll pay nothing. Call Westway Financial now for your free information kit. 800-714-9090. That's 800-714-9090. 800-714-9090. When life is chaos, your home is your safe haven. It's your most important asset. But do you own it? Don't be so sure. Imagine getting a credit for non-payment of a loan you never took out. It happened with Deborah, and it's happening everywhere. It's called home title theft, and the FBI calls it one of the fastest growing crimes. It's why I urge you to get Home Title Lock. Your home's legal title is kept online, and thieves know it. They'll forge your signature on your home's title, and that's it. They legally own your home. Then they can take out loans on your home. Your bank doesn't cover you, and neither does your insurance. The only way I know to avoid this nightmare and possible eviction is with Home Title Lock. Go to Home Title your address to see if you're already a victim. And use code RADIO for 30 free days of protection to help you through this crisis. Go to HomeTitleLock.com. HomeTitleLock.com.
Cars for Kids has become the most trusted car donation charity. Cars for Kids also accepts donations of real estate. If you're spending money on a property you don't use or hassling with out-of-state properties, donate to Cars for Kids instead. It's simple and easy. It'll take over all taxes, maintenance, and insurance obligations. You'll receive a tax deduction from the full appraised value of your property. To donate, visit carsforkids.org/real estate or call 877-CARS-FOR-KIDS today to learn more. That's Cars with a K.
The state of Colorado is now starting the process of reopening, and among the businesses getting back to work is the JBS meatpacking facility in Greeley, Colorado, the source of one of the state's largest outbreaks of COVID-19. More than 100 employees at that plant were infected, and at least 5 people have died. Joining me now from Colorado is NBC News correspondent Gotti Schwartz. So, Gotti, I understand there's hesitation among some of the workers going back inside that plant?
Yeah, there was hesitation over the weekend from some of these workers, even more hesitation now that they've learned that that 5th employee has died. What we've seen here is employees arriving at this parking lot. Most of them are wearing masks as soon as they get out of their car, and then they go into this great tent here, and this is where they are screened before reporting onto this. But people are they have a fever, they are tested for COVID-19. However, it is not what a lot of employees wanted to see. They say that before this plant was temporarily shut down, they were told that everyone was going to be tested before the plant reopened, and for some of them, they're scared to come back to work because the work worker is saying that she didn't want to come back, so God was hospitalized, put on a ventilator, and she says they're reopening too soon. Take a listen.
It's very scary, and it makes me angry that the company is willing to open without testing people.
Now, JBS, the company here, says that the reason why they reopened is because they basically were operating under the assumption that their entire workforce had COVID-19, so they stopped production for about 2 weeks, sanitized everything inside, reopened it, put up some plexiglass, and they are now giving their employees protective masks. They have also increased their salary, or increased their pay per hour by about $4, and giving them $600 in addition to that as a bonus. But again, these employees say their main concern right now is the asymptomatic carriers, the carriers that might make it through this screening tent with no temperature onto the processing floor and still be spreading COVID-19 without even knowing it. Back to you.
And this is Gotti Schwartz in Colorado. Gotti, thank you very much. And that'll do it for me this hour. Everybody stay inside, stay safe, stay healthy, wash your hands. But stay watching this network. Brian Williams and Nicole Wallace pick up our coverage after a really quick break.
Greetings, East Street Nation. This is Bruce Springsteen coming from my house to yours. Music for troubled times. Bruce Springsteen, from his home to yours. Part 2. I will be your DJ for your dancing and listening pleasure. Anytime on demand at SiriusXM.com, and use the code RADIO20 for 20% off. Say goodbye to Best Line forever. SiriusXM.com, promo code RADIO20. I'm Eric Ray, co-founder and CEO of Podium. A few years back, my dad called with a problem. Despite having tons of happy customers at his website, left online reviews. He was stuck with an online reputation that didn't match how customers really felt. And he wasn't alone. Local businesses everywhere still being held back by outdated technology, leading to frustrated, lost customers, and wasted time. We quickly learned that people would rather just send a text, a Facebook message, or an Instagram post. Anything but having a call, just put on hold, or play phone tag. With Podium, getting more views, sharing news, and keeping customers coming back can all be done remotely. It makes interacting with every step of the customer journey the easiest way to pick up. And when you interact with customers first, you can quickly come to the
far higher, as just over 1.5% of the American population has been tested so far. According to Johns Hopkins University, there are now over 3 million cases that we know of worldwide. The White House scheduled a briefing for today, only to cancel it. Then it announced the president will hold a news conference instead about 2 hours from now to talk about testing and other steps to reopen the economy. There were no briefings this past weekend. After the president questioned their usefulness, that followed the backlash over his remarks on injecting disinfectants into the human body and inserting UV light, which he claimed to be sarcasm. More states are taking steps toward returning to normal. Alaska, Colorado, Georgia, Minnesota, Mississippi, Montana, Oklahoma, Tennessee, and Texas have all done some version of loosening restrictions, paving the way for businesses like restaurants, gyms, hair salons to reopen. And overseas British Prime Minister Boris Johnson returned to his office 3 weeks after being admitted to an intensive care unit. He marked his return with a speech warning that the UK is still in a period of maximum risk and gave no timeline for reopening schools and businesses. So happy to be joined for this hour by my colleague Nicole Wallace. And Nicole, walk us through what you think the White House thought process might have been. We've gone 2 weekend days without the usual daily briefing, and absent whatever public education comes from the coronavirus task force news conference every day, are they engaging in a fiction that perhaps a different Donald Trump is going to show up in the format of a news conference today?
The element they have is the fiction. There is no thought process. There is no strategy session. There is no staff.
Here's some corner there.
For the White House staff.
Huh?
There's Donald Trump and the reflection of himself in cable news coverage. And I'm not even, it's not clear that he's print coverage, but he's seen clips of print coverage as they're discussing cable news coverage and on social media. So that is what navigates every single decision, every single public utterance, and every member of this White House. And notable to me is that they still haven't used that room, the White House briefing room or the Rose Garden, rooms from which wars have been declared and ended, rooms where really momentous decisions have been made. And it was a room like that in which the president of our country told people to ingest bleach. They haven't used any of those stately rooms that connote importance to listen to statements. They haven't correct not just to the listening public, but to the president. So everything they do is sort of a feeble attempt to keep reading out of
1,000 people, the cases, the hospitalizations, the death rate. And we see these lower key numbers here. 1.0 for every 1,000. 1.3 for every 1,000 people in South Carolina. 2 there of 1 hospitalization per 1,000. Small. Compare them to where it's been. That explains a lot of the impetus for this. One thing that you probably have to note of caution here in these numbers is right here. It's the testing rate. As we said, per 1,000. Remember, so much attention to the idea of having
ready to go now.
as a key ingredient. Reopening, we'll look in New York. Again, an epicenter of this.
Well, you got it.
For every 1,000 people are being reported in South Carolina. You had to divide that. You got to cut that down to 10 for every 1,000. So you don't have a high, widespread testing rate. And again, you see that, in other states as well. You can see that in Minnesota, which is the state doing some reopening again. You see how much smaller it is than New York. You also see that smaller testing rate. Georgia, another one that's gotten attention. Again, the cases, the hospitalizations, the deaths, much smaller than you get in New York, also less testing. But again, it's even within a state. We're going to look at New York. So, for instance, what we see here is the New York City, Long Island, suburbs outside of it. Right here, this is the heart of New York. So we're usually talking about the historical statistics. This is the rest of New York. Here are the statistics for all of New York that's not in New York City metro area. That's cases, deaths. Compare that to New York City. The fifth one to death. Totally different story within the same state. That's why you got former living in New York, the governor there talking about.
I'll try to line that up.
It's this policy that we start with.
Okay.
and not so much this part of the state. Now, Steve Kornacki at the big board using numbers to lay out this argument in the quality between astronomers and solid for telescopes that years ago or decades ago were just
They got it on there. Make sure you talk.
We'll try to kick it up the chain. Nicole Wallace, thank you. We're going to both take a break.
I know.
So when that light will turn green, I can go there.
Sorry.
This is your fault.
The clock is ticking. Everything you put up on life insurance.
Well, they got switch track for that.
The older you get, the more you'll have to pay. And if some accident or unexpected illness can cause your rates to skyrocket, or even make you uninsurable. Beat the clock. Call Select Quote now. No hassle, no obligation. In minutes, you'll have a choice of your best rates from up to 10 rated life insurance companies. Your result makes the quote more.
I'm get over and try to hurry. Probably hurry. spot coming, man.
Normally bustling with tourists, now completely empty. For weeks, the doors at Las Vegas casinos have been shuttered, leaving casino workers, and think of this, the bartenders, the dealers, the servers, the cooks, the cleaners, professionals who do not have the luxury of working from home, with no wages, no tips, no other option. In some cases, the New York Times called Las Vegas, quote, ground zero for this rapidly evolving jobs crisis. They write, applied analysis of Las Vegas-based economic research firm estimates the city's current jobless rate is to be about 25%. We are happy to be joined by
normal day ain't got there yet.